activist Marilyn Clement has died at the age of 74. And those are some of the headlines. This is Democracy Now!, democracynow.org, the War and Peace Report. I'm Amy Goodman with Sharif Abdel-Qaddous.
And welcome, everyone. Since President Obama's inauguration, two of the Democrats' key legislative priorities have made significant advances in Congress. In June, the House passed a landmark climate bill that imposes the nation's first ever congressionally mandated emissions cuts. And following weeks of intensive negotiations, the House on Friday cleared the way for a September vote on legislation to alter the nation's healthcare system. Today we spend the hour with one of the most influential members of Congress, who's played a key role in the debate over climate change and healthcare, among many other issues. Democratic Congressmember Henry Waxman has represented California's 30th Congressional District for nearly 35 years. As chair of the House Energy and Commerce Committee, he oversaw the talks that led to the panel's approval of healthcare legislation, clearing the way for a full House vote when lawmakers return in September. Progressives have challenged the Democratic leadership's healthcare effort for ruling out single payer, where the government would guarantee coverage for everyone. And after a series of compromises, including with the conservative Democrats known as the Blue Dogs, questions remain about whether the current legislation adequately safeguards a government-run public option that would compete with private insurers. Congressmember Waxman also introduced the landmark climate legislation that the House passed in June. The American Clean Energy and Security Act would cut emissions 17% below 2005 levels by 2020. It would then cut emissions 83% by 2050. The bill would also impose a cap-and-trade system allowing firms to trade emissions permits. Most Republicans opposed the measure, but several Democrats also voted against it for not going far enough. Environmentalist critics say the emissions cuts are too low and could be easily avoided through flawed methods of monitoring compliance. In the years since the U.S. invasion and occupation of both Iraq and Afghanistan, Congressmember Waxman has also emerged as a leading voice for the oversight of private war contractors such as Blackwater and Halliburton. He has also sought to crack down on lavish executive pay in the wake of the Wall Street bailout.
Congressmember Waxman has just come out with a new book on his time in office. It's called The Waxman Report, How Congress Really Works. Congressmember Henry Waxman joins us in our Firehouse studio for the hour. Welcome to Democracy Now!
Thank you very much. Pleased to be with you.
You are
I thought you were going to hold up the book.
One of the key power brokers in Washington. And the legislation that has just passed around health care. I think the biggest issue in the media has to do with polls, who's ahead, who's behind, but never actually explanation. Talk about the key components of your health care reform bill.
The legislation is based on the argument that President Obama made to the American people, that he wanted to make sure we had an affordable, good quality health care insurance coverage for every American. He suggested doing it in a way that was politically sellable. He wanted to tell people that they didn't have to be nervous. If they had insurance that they liked, they got to keep it. If they were on Medicare and they wanted to stay on Medicare, Medicare would continue to be there. But for everywhere else, in order to get your insurance, you would go through an exchange and then choose between insurance plans, one of which would be a public plan, the others would be private insurance plans. This whole concept was the argument he made to the American people, for which he received a mandate, and now he's calling on Congress to enact it into law.
And as part of these negotiations with the conservative Democrats known as the Blue Dogs, one of the issues was he dropped a provision that would have linked the public option to rates paid by Medicare. Now they would have to negotiate those rates, which typically would be higher. This has come under heavy criticism. What's your response to that?
The compromise we made with the conservative Democrats on that issue is that for the public plan, first of all, there would be a public plan, and the public plan would have rates set between the Medicare rates and the average of the private insurance companies in a particular region. And the Secretary would make that decision and provide those kinds of reimbursements for providers. But step back a minute and realize how important this bill is. There would be no ability for the insurance companies to keep people from getting insurance for pre-existing conditions or charging them more if they offer a potential risk for illness. Insurance companies would have to abide by very strict regulation. Secondly, for low-income people, there would be a subsidy to help them buy their insurance coverage. And that would be insurance, whether it's the public plan or a private plan. There would be an expansion for low-income people to be on Medicaid or in the insurance option. And that's going to mean large numbers of people who have been uninsured for so long, too long, would be able to get access to health care services.
And were some of these subsidies to low and middle income people cut as part of this last-minute negotiation?
There was a trimming of the premium. We wanted to protect people from out-of-pocket costs for their premium at 11% of their income. We moved it up to 12% of the income. Then there's an indexing of what people will pay as health care costs go up, and their salary may not go up as fast, and that was split between the individual or the family and the government. Many members of the committee, especially the progressive members of the committee, did not like that. And so we provided for greater cuts in things like pharmaceutical reimbursements, and said all the money that we save will be directed to restoring the protections for those who are going to have subsidies for their insurance.
You've been a longtime supporter, Congressman Waxman, of H.R. 676, of the single-payer bill, but you withdrew that support. Why?
A single-payer bill does not really have a chance to pass the Congress. It would be a radical transformation of our health care system. Some people could say, it's fine, we should do it. But I don't think the Congress would have any realistic chance of passing a bill like that. You'd have to take all the insurance coverage that's provided on the private sector and switch it over to the government. There'd have to be massive taxes increases to make up for the lost money that's now being spent by employers for their employees. And by the time we would be through trying to accomplish something like that, the Republicans would demonize it. So what President Obama suggested was a practical compromise way to accomplish the goals that we wanted. There are other ways to get universal coverage as well. Senator Wyden and Bennett had an approach that would end employer coverage by, in effect, giving people an opportunity to go buy private insurance. That would work. I have some misgivings about it. But it also is a radical transformation of health care.
So why did you support it for so long?
Well, I wanted to argue that this was a way to cover people. And it's the way many countries provide health insurance. And if we were starting from scratch in this country, we might well decide that that would be the way for us to go. But we have right now a system that's been in place since World War II, where most people have their insurance through their jobs. And we thought it would be much too disruptive, and people would be much too anxious if we took things away from them with the promise that they're going to get something else. And I didn't think Congress could pass it.
No. Oh, go ahead.
Just a quick question, follow up on that. And the CBO has scored the current plan and say it's something like $1 trillion, for which it's been criticized by a number of Congress members. Why not score single payer?
Single payer would score well because the government's then paying for the health insurance. But it would be a radical change in health care. And some people say that's fine, except as a practical matter, it couldn't pass. Now, one of the concessions we made to the progressives on our committee when we had to satisfy the Blue Dog demands is I called Speaker Pelosi and I said, let us have a vote on the House floor on the single-payer system. So we'll see how well the single-payer system does on the House floor. I don't expect it would pass. But on the other hand, it would be the first chance ever for single-payer to be brought to a vote on the House floor.
But that would be after the current vote, right? Is it something like by December?
Well, I don't know what the timing would be, but it would be people on the House would be able to vote for single-payer.
We're going to break, then come back to this discussion. Our guest is Congressman Henry Waxman for the hour. Yes, he's the Congressmember from California who chairs the powerful House Energy and Commerce Committee. We're also going to be talking about global warming and the legislation around energy, as well as his past, his history, and how he came to be where he is, one of the key power brokers in the U.S. Congress. Stay with us.